Hi everyone, welcome to my pathophysiology project on endometriosis. This presentation is meant to be a high-level overview of what you need to know about endometriosis if you've only got about 8 minutes. I will broadly cover the primary sections so that you can get a general sense of the clinical manifestations, etiology, pathogenesis, mechanisms of disease, and diagnosis. However, if you have more time or are particularly interested in this topic, I encourage you to read through my full project or perhaps just one of the sections that you're keen to learn more about. So without further ado, let's jump right in. So first, what is endometriosis? Endometriosis is a gynecological condition in which the endometrial tissue, which normally grows inside the uterus, grows outside of the uterus. It is estimated that endometriosis affects 10% of women of reproductive age. Clinical manifestations. As I mentioned in the previous slide, endometrial tissue grows outside of the uterus and can grow in various areas of the body, such as on the ovaries, fallopian tubes, bowels, or bladder, which can result in pelvic adhesions and distortion of pelvic structures, causing pain and fertility challenges. Some of the signs and symptoms of endometriosis include generalized pelvic pain, low back pain, painful periods, heavy menstrual flow, pain during intercourse, bowel and bladder symptoms, and subfertility. Etiology and pathogenesis. The etiology and pathogenesis of endometriosis is unknown. However, several theories exist, including retrograde menstruation, coelomic metaplasia, and lymphatic/vascular metastasis. So the first one, retrograde menstruation, which is shown here in the image on the left, is when menstrual blood flow, which normally comes out the vagina, exits the uterus in the opposite direction through the fallopian tubes and into the pelvic cavity, which can lead to inflammation. Retrograde menstruation is the leading theory to explain the cause of endometriosis. Another theory, coelomic metaplasia, involves the transformation of normal peritoneal tissue to ectopic endometrial tissue under certain conditions, such as, for example, chemical exposure. And a third theory, the lymphatic vascular metastasis theory, is when menstrual tissue gets into the lymph nodes and is transported through the body in the lymphatics and then into the circulatory system. So in addition to these three theories or hypotheses, there are several other factors such as oxidative stress, immune dysregulation, inflammation, hormonal imbalances, and genetics that play a role in the pathogenesis of endometriosis, suggesting that endometriosis is a condition with complex multifactorial origins. Pathology and mechanisms of disease. So endometriosis development, as I said, is considered a very complex process caused by genetic factors, endocrine factors, and inflammatory and immune factors. So we'll go through each of these briefly here. So in regards to genetic factors, the pathogenesis of endometriosis is at least in part due to alterations in genes that facilitate the proliferation, implantation, and survival of the endometrial tissue in the peritoneal cavity. There's also research being done on certain gene polymorphisms and their effect on estrogen metabolism, specifically mutations in the GYP17A1 gene may contribute to the onset of endometriosis. As for the endocrine factors, so at the heart of endometriosis is the fact that it's an estrogen-driven disease. And research shows that in women with endometriosis, their endometrial tissue exhibits higher estrogen and lower progesterone locally. This is because the endometrial lesions have increased expression of the P450 aromatase enzyme, which allows for estrogen overproduction. And these lesions have decreased expression of the 17-beta hydroxysteroid dehydrogenase enzyme, which creates progesterone resistance. So this high estrogen and low progesterone locally in the endometrium creates the perfect storm for the growth and inflammatory process we see in endometriosis. And finally, the inflammatory and immune factors. So women with endometriosis are known to have elevated levels of inflammatory mediators, such as cytokines, lymphocytes, and macrophages in their peritoneal fluid. Further, they have immune alterations such as decreased T cell reactivity and impaired natural killer cell function. So for these reasons, following the retrograde menstruation, endometrial tissue is actually able to evade immune clearance of the menstrual debris from the peritoneum, allowing the ectopic endometrial cells to implant and grow. So these cells will induce inflammation and recruit macrophages and leukocytes, and thereby promote the development of endometriosis. So if you're interested in more information on the cellular mechanisms and specific pathways for any of these factors, please refer to the pathology section of my project. Diagnosis. Endometriosis can take many years to diagnose. Unfortunately, the only way to receive a definitive diagnosis is to undergo laparoscopic surgery, which is considered the gold standard. The surgery involves making a small cut in the abdomen so the surgeon can use a laparoscope to look at the reproductive organs and intestines to confirm the existence of lesions. But before recommending surgery, the doctor may like to take a number of steps to rule out other health conditions that could be causing symptoms and to see if surgery is unnecessary. These steps may include pelvic exam and/or imaging tests such as ultrasound and MRI. If surgery is necessary, the surgeon will perform an excision removal of the endometriosis. As you can see here in the image, it is incredibly important to find an experienced and skilled surgeon to perform this surgery. So if your client or a friend or family member is diagnosed with endometriosis, where does she go from there? As there's no cure for endometriosis, women can work to manage their symptoms appropriately, and she'll likely be under the care of an OB or another endometriosis specialist. But additionally, women may like to consider working with a holistic health practitioner such as a nutritionist or an acupuncturist who can recommend diet and lifestyle modifications for supporting estrogen detoxification, managing inflammation, modulating the immune system, and naturally reducing pain. So give her hope that she can live a happy, healthy, hopefully pain-free life with endometriosis by managing the condition properly. So that's the end of my quick presentation. Thank you for listening, and I hope you feel you now have a good grasp on the pathophysiology of endometriosis. For more detailed information, feel free to read through my presentation below. Thanks.